Hey guys, this week's video is all about erectile dysfunction. It's time to learn what it is and what you can do to help. So erectile dysfunction is when you can't maintain or keep an erection. Now, it's completely normal if it happens every now and then, but if it's happening quite often, then it can cause a problem because it can cause problems in how you feel about yourself, it can cause problems in your relationship with your partner, and it can also be a cause of concern because there might be an underlying health condition that's causing it. This is why it's so important that if you do have erectile dysfunction, you speak to your healthcare professional. Don't just leave it, speak to your healthcare professional. That is the most important thing I'm going to tell you in this video. So now let's dive into lifestyle changes that everyone can make to really have a positive impact. And the first thing I want to ask you is, what is your diet like? How healthy is your diet? Are you having foods that are high in cholesterol, or high in saturated fats on a daily basis? And I really want you to be harsh with yourself on this and really think about it and give yourself an honest answer. Now, if you're wondering what these foods are that are high in saturated fats or high in cholesterol, there's going to be a box that's appeared here already, hopefully, and it's got a list of these foods there for you to look at. So feel free to pause the video right now, have a quick look, see if any of them apply to you. Now, the reason why I'm asking you to really think about it and how healthy your diet actually is because if you're not having a healthy diet, it's going to cause an increase in our cholesterol and it's going to potentially cause an increase in your blood pressure as well, both of which can cause erectile dysfunction. And what they're going to do is they're going to reduce the blood supply going to the penis and therefore reduce the oxygen as well going to the penis, which definitely don't help with erectile dysfunction. So they're aiding to the problem. Now, this moves us on nicely to our next point, and I really want you to think about this as well, is what is your current weight status? Are you overweight? Are you underweight? Are you normal? And if you're unsure of it, I am going to leave a BMI calculator in the description below. It's very easy to use. All you do is you put your age, your weight, your height, your gender, you put them in it and it gives it your BMI. And once you've done that, you're going to have a bit of an outlook as to what your weight status is. If you are overweight, we know that it can put you at a higher risk of erectile dysfunction. So you need to be at a normal weight. This is again going to help with erectile dysfunction. And if you want to know really good ways to lose weight, I do have quite a few videos on this topic which have over 15 or 20 million views in total, looking at scientifically backed studies on how to lose weight. So if you're interested in losing weight, if your BMI is above 25 of course, then please feel free to check those videos out. I will leave them in the description below. Now, moving on to our next point, which is the next question I want to ask you, is how often are you exercising? Look, exercise can also be really helpful for erectile dysfunction. It can help with our blood circulation. It can also help with our blood pressure as well at reducing it. As we know, high blood pressure can cause erectile dysfunction. So we need to make sure that you're doing enough exercise. And the question I want to ask you is, are you doing 150 minutes of moderate intensity exercise per week? That's about 21 minutes per day. And if you're not doing that, you need to try and build it up slowly. I'm going to put some ideas as well in the description below, all about different exercises that you can do. So as I mentioned, all of this exercise and our healthy eating and not eating foods that are high in cholesterol and saturated fats are going to help keep our blood pressure at a normal level. And we're looking at a normal range of about 120/80. That's a really good blood pressure. Anything above 140/90, so if you have your own blood pressure machine at home, it's great for you to have a little go on it. Maybe take a week's worth of readings, morning and night time, and see if the readings are high or if they're normal. If they are high, then please speak to your healthcare professional about them because something needs to be done about it. But we know that maintaining good exercise and good diet can help with the blood pressure, which in the long run is going to help with erectile dysfunction as well. Now, here's a little pro tip that I want you to consider if you are a cyclist. If you're cycling 3 hours or more per week and you're having erectile dysfunction, it might be worth just stopping cycling for at least a week or two to see if there's any improvement. Sometimes the cycling can actually cause the erectile dysfunction or make it worse at least. So if you do see an improvement and you still want to cycle, then it might be worth getting a professional seat fitted or made to help reduce the erectile dysfunction symptoms as a result of it. So the next question I want to ask you is, how many hours of sleep are you getting per night? Are you getting 7 to 8 hours of good quality sleep per night? And by good quality, I mean having a routine, sleeping at a certain time every night and waking up at a certain time in the morning to get your 8 hours of sleep. If you're not doing that, this could potentially have a negative impact on your erectile dysfunction and make things worse. It can also cause many other problems as well, such as weight gain as well, by not getting enough sleep. And some studies have actually shown that not getting enough sleep can actually increase your risk of certain cancers as well. So you really need to be looking at getting your 7 to 8 hours of good quality sleep. If you are someone that struggles with going to sleep, I do have a few videos on that topic, which I will leave up here and in the description below for you as well. So the next thing that I want to talk to you about is actually an invisible cause for erectile dysfunction, and that is all about your mental health. How are you feeling at the moment? Are you feeling more anxious? Are you feeling more stressed? Are you feeling depressed? Are you feeling these kinds of symptoms? So are you having negative thoughts at all? Are you having suicidal thoughts? Are you having times of low mood where you don't want to go out or speak to anyone, or you're no longer enjoying your hobbies that you used to like, or you're having any thoughts of self-harm or any negative thoughts like this? These are all thoughts that are showing that your mood might be low and deteriorating, and it can actually be one of the causes for erectile dysfunction. Another thing that I want you to think of as well is, are you sexually aroused at all when you're with your partner? Because all of these, if there's been a change in it, can indicate some form of change in your mental health, and it's super important that you speak to your healthcare professional about it so they're aware of it and they can help you with it. So the next question I want to ask you is, how much alcohol do you consume? If you don't drink any alcohol, that's perfect. It's definitely going to help with the erectile dysfunction. But if you do drink alcohol, it could be making things worse. Now, it's recommended that you don't drink more than 14 units of alcohol per week. I know it's very difficult to know how many units of alcohol you're drinking per week, so I'm going to leave a calculator in the description below. It's really easy to use, and you can calculate how much you're drinking and whether you need to reduce that consumption or not. It's also important to remember that you need to have alcohol-free days. If you do drink alcohol, make sure you're not drinking 7 days per week. So ideally, if you're drinking 14 units per week, it needs to be spread over 3 to 4 days. That way you're having at least 3 to 4 alcohol-free days as well. Smoking can also make erectile dysfunction much worse. It's really, really bad for it, and if you do smoke, please, please, please quit. And I know it's easier said than done, but it's definitely going to help with the erectile dysfunction. It's definitely going to help with reducing your risk of cancer, and it's definitely going to help with all of the other medical conditions that it can cause. So if you do want to quit, if you're thinking about it and you really want to do it, I do have a video on the topic which has helped thousands of people around the world. So if you want to find out more information on it, I will leave a link to it up here and in the description below. And once again, I'm going to mention this again because it's super important that you're aware of it. Sometimes erectile dysfunction can be caused by another health condition. There might be an underlying health condition that's causing it. So it's super important, if you are having erectile dysfunction and you haven't spoke to your healthcare professional about it, please speak to them first before doing any of the things that we're speaking about in this video. Please speak to them first and make them aware so they can do the relevant investigations to find out that you're okay. That is the most important thing, because your health is the most important thing. Okay, so now let's move on to treatments for erectile dysfunction. But before we begin, I just want to say a quick thing. Please remember that treatments are not a replacement for the lifestyle factors and things that we just spoke about. It's important that we make those lifestyle changes, and if it's needed, then the treatments are going to help with the erectile dysfunction as well. That's super important that you remember that. Also, please remember that the treatments are all prescription only, so you will need to speak to your healthcare professional about them. Some of them you can buy over the counter as well, but again, you need to speak to your healthcare professional about them so they can make sure that you're safe and suitable to take them. Now, I'm sure you've all probably heard of the most famous pill that's given for erectile dysfunction. The branded name is Viagra. This is a phosphodiesterase 5 inhibitor. The generic name, so the actual drug name for it, is sildenafil, but there's loads of these phosphodiesterase 5 inhibitors. Also, for example, vardenafil, tadalafil, and they all work by widening the blood vessels in the penis so more blood can flow into there. Now, it's important to remember that these medicines aren't an instant fix, so they can take about 30 to 60 minutes for their full effect. You also need to have a sexual desire to still get the erection. That's also important to remember. Sometimes the pills don't work for everyone. You might need to try a few different ones to find the best one that works for you, really. And the common side effects of it include headache. That's quite common. It can also cause flushing of the skin. So the way that it would work in practice is you would speak to your healthcare professional first, and obviously then do all the relevant investigations to make sure there's no underlying health conditions that are causing this problem, and then they could potentially prescribe you this medication, for example, or anything else that they think is suitable. And then the usual way that it works with phosphodiesterase 5 inhibitors, like your sildenafil, tadalafil, vardenafil, is to give you a lower dose to begin with, to give you maybe a pack, and then to come back in a couple of weeks to review again to see how you're getting on, if it helped, and if it didn't help, you might try increasing the dose or try an alternative medication. Now, I know that this can be a slightly embarrassing topic for some people, especially when you have to speak to your healthcare professional about it, but please remember, we speak to patients all the time about erectile dysfunction. It's nothing out of the ordinary for us, so it's super important you remember that you speak to your healthcare professional, because like I said earlier, there could be underlying health conditions that are causing this condition, and it's important that the relevant investigations are done first, just to make sure that you're safe. And please do remember, like I mentioned earlier, high blood pressure can make erectile dysfunction worse as well. If you do have a blood pressure machine at home, like I said, it'd be really useful if you did 7 days worth of readings, wrote them on a paper in the morning and in the evening, do them, write them down, and show it to your healthcare professional so they can average it and see how your blood pressure is, because this could be affecting it. Another thing your healthcare professional might discuss with you is your cholesterol. If your cholesterol is high, they might start you on cholesterol lowering medication or make some lifestyle changes for it. That's entirely dependent on your healthcare professional, but again, this might be one of the things that they do with you as well. And another important point I just want to make before we move on to the causes of erectile dysfunction is if these treatments don't work, the phosphodiesterase 5 inhibitors, such as your vardenafil, sildenafil, your tadalafil, if they don't work, there are other treatments available as well, so please just bear with it. They might have to refer you to other people who are more specialized in the area, but there are other treatments available as well. So now let's move on to the causes of erectile dysfunction, and to understand that, we need to understand the anatomy of the penis a little better. So the penis has fine blood vessels that deliver the blood and oxygen to it that are going to help with the erection. Now, these blood vessels are a little wider than the fine blood vessels that we find in the kidney or the heart, but that is so we can get lots of blood there to help with the erection. Now, when we have certain medical conditions, for example, if we have high cholesterol, or if we've got high blood pressure, or if we've got high blood sugar, it's going to reduce the amount of blood that can go there, so it's going to cause the erectile dysfunction. That's a very basic explanation of it all, but I think it's really going to help. And this is one of the main reasons why I keep saying in this video that if you do have erectile dysfunction and you haven't spoke to a healthcare professional about it, please do. You now understand a little better what's causing it, and now you're starting to see the underlying health conditions that could potentially be causing it. So it's super important that you speak to your healthcare professional if you haven't already. Now, certain medicines can also cause erectile dysfunction as a side effect. So if you are taking a few medicines, please don't just stop them, because it's not many medicines that actually cause this. But if you are taking a few medicines and you're starting to notice that you're getting a bit of erectile dysfunction, then speak to your healthcare professional again so they can check it out and make sure that their medicines aren't actually the cause, and they can do the relevant investigations that are required. And please also speak to your healthcare professional if you feel like there's been any change in your toilet habits. So for example, if you're weeing a lot, if you're struggling to get a steady stream, if you're having any incontinence issues, if you're having any pain or discharge from the penis, anything like this, please speak to your healthcare professional quite urgently. So that's the end of this week's video. I really hope you found this information helpful on erectile dysfunction. You now know all about the lifestyle changes you need to make, you now know all about the treatment, you now know all about the causes, and also you know when to speak to a healthcare professional. As I said, that's the most important thing. Thank you for watching. You're now a bit of an erectile dysfunction pro. I really hope you found this information helpful. And as I always say, sending you awesome vibes, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.